Okay, next slide. Yeah, okay. This is the slide I was talking about, the acute shortage of specialists and super specialists in the country. Next slide, please. Next slide. Yeah, this gives you a background of the remote healthcare division. Yeah, this slide gives some factual data about the remote healthcare division of Apollo Hospitals. As you can see, we have a very large telemedicine division, teleradiology services, disease management programs, e-ICU services, and so on. Next slide. What is very peculiar or what is fantastic about Apollo Hospitals is it's not only a quaternary care hospital which does combined heart and liver transplant, but on the same day it also does health literacy programs, and sometimes we connect to as many as 51 villages in the common service centers. Next slide. I'll very quickly run through the growth of Apollo Telemedicine. Today we have about 150 centers in India and 14 outside India. We have done more than 300,000 primary voice teleconsults and about 100,000 specialty and super specialty teleconsults. Our major customer is the government, state governments, and I'll quickly touch upon this. Next slide. As you can see in the next slide, 3 international conferences on telemedicine and several papers have been published, presented, etc. Next slide. Now, if you look at the portfolio of Apollo Telehealth Services, we primarily have a public-private partnership with the government of Himachal Pradesh, which I'll be talking on in detail at Pune, so I'm just quickly going through it. We have so far provided 8,600 teleconsultations at a height of 14,000 feet in the Himalayas. We also have a major project with the government of Andhra Pradesh, 164 primary health centers, which I'll be touching upon. We were also one of the first to start for the Ministry of External Affairs the Pan-African E-Network project, which will be continued in a few months from now. We also have a teleradiology section and an NCD screening and management program. Next slide, please. And of course, from a historical point of view, the world's first VSAT-enabled village hospital was commissioned by Clinton on March 24, 2000, and ISRO has publicly acknowledged that this was very helpful to them to for them to decide on having VSATs in other parts of the country. Next slide. Now, if you come to my department, next slide, please. This is what you will see on any given day. We do an average of about 70 to 80 consultations, both in India and about 3 to 4 outside India, Afghanistan, Colombo, Dhaka, Maldives, and so on. Next slide. We try to use remote healthcare wherever possible. Next slide, please. I mean, putting up these pictures now look very silly, but believe it, in 2001, it was a tremendous job to do a teleconference, and again, we were one of the first to do it in the country with the US, with Riyadh, Singapore, and many other countries. Today, of course, teleconferencing is done as a routine. Next slide. This is just I am a neurosurgeon by training. This is just a snapshot. About 20% of all the teleconsults done from Chennai alone are in neurology and neurosurgery. Next slide. No, okay. Now this is complex cases like this. We do webcasting. This is an example where more than 7,000 people witnessed this marathon surgery lasting for almost 18 hours from different parts of the world, and we do all this using our in-house IT department and telemedicine team. Next slide. This is just the Himalayas I was telling you. Before we came, this was how patients used to be taken. For 5 months in a year, the area, Lahul and Spiti, is totally cut off. The temperature is minus 25 degrees. And after our intervention for the last 2.5 years, we have also significantly reduced the number of helicopter evacuations and so on. Next slide. I'll be showing a live demo from Pune. Next slide. This is again showing the statistics. Again, as to the best of my knowledge, we were the first to do a tele-emergency services. And here what the success of this project was, we recruited people from the community, brought them to Chennai, trained them for 3 months, and they've all gone back now and they're doing a wonderful job. Next slide, please. Next slide. Yeah, these are just some clinical examples. Next slide. All this done in the Himalayas. Next slide. We make house visits because sometimes the patients are not even able to come. This was now we use point of care diagnostics, and my staff goes to the houses of people in the community and check their hemoglobin, HbA1c, and where clinically indicated, we can even do liver function tests and renal function tests using point of care diagnostics. Next slide. Too much of time. Cervical cancer screening, again, this is still a pilot project there. About 55 women have been screened with a tele-cervical cancer. Obviously, there is no qualified gynecologist available in the Himalayas. So one of our gynecologists here supervises it with a trained, semi-trained nurse. We have been able to take pap smears, and in just 55 cases, 4 people with carcinoma in situ have already been discovered and attended to. I can just see this is a helicopter evacuation which has come down tremendously after our intervention. Next slide. After stabilizing patients, we shift them sometimes. Another major thing which we are doing is a tie-up with public sector undertakings. The National Thermal Power Corporation as a pilot project in a remote part of Assam. We established a teleclinic which is almost 9 months. We have been functioning there, and based on the success of this, we are likely to do similar things in many of the other National Thermal Power Corporation factories, most of which are located in very remote areas where it is impossible to get a medical doctor to physically stay. Next slide, please. These are some statistics. Next slide of what we have done in Assam. Next slide. Another major part where we are using technology is corporate social responsibility. We have a tie-up with a major multinational company. Next slide. And we are very happy that we have screened already 300,000 people. I am not aware of any organization in the private sector which has done this. We use technology to the maximum, including online, immediate, in a camp mode. We are able to get a medical doctor, a diet counselor, and so on in a camp mode. We provide them with tele-medical services in a camp mode. Next slide. This is called the Get Active program. Now, this is just to summarize, just to tell you what we have done. 7,333 people who never knew that their sugar was raised or the HbA1c was raised. Anemia, this was fantastic. 51% of girls studying in educational colleges in Delhi, Pune and Chennai were found to be anemic with a low PCV. All this we did with a point of care diagnostics test. Next slide. Next slide, please. Okay, we have had in the educational field, though we are a corporate hospital, we have still been able to carry out several programs, and we have mentored several groups of people who have come from Columbia University, Harvard Business School, Wharton, Yale Institute of Management, and many other MBA programs, dissertations. Students come here and we help them do their programs. Next one. The Pan-African Network, I've already spoken to you about. Next slide. Now, in addition, we have a tie-up with the MS Swaminathan Research Foundation. This is the major study I was telling you about. Government of Andhra Pradesh. Live, you will click on this dashboard. Immediately, the Chief Minister's office, the Health Minister's office can in real time see who are the people entering the 164 primary health centers. Next slide. Next slide, please. These are just, here you can see we have given teleconsultation to almost 1 lakh of people. 101,000 people have been given specialist teleconsultation. Some of them, of course, repeat. This constitutes 6% of the huge of 9.34 lakh people who have, 7.19 lakh people who have unique patients who have come to these 164 centers over the last 1 year. Next slide. The most fascinating thing about this is a public-private partnership with the government of Andhra Pradesh. Next slide, please. Detailed analysis of this is being done and is available to the government. I mean, I could go on and on, but I was told there are only 10 minutes available. I would just like to tell our Russian friends that India, sir, is changing completely. This is the India of today. You can see these two on the top. You can see two infants probably preparing for the NEET medical entrance exam or maybe the IIT entrance exam. The bottom two slides shows people, octogenarians, nonagenarians, 80, 90 years old, absolutely familiar with a computer. And India again, Kerala, a district in Kerala was ranked by the United Nations as the first district in the whole world to have 100% computer literacy. I am very confident that in the next few years, telehealth, I don't like the word telemedicine, I think telehealth is a better word, will be an integral part of the healthcare delivery system, not only in the government sector, but in the private sector as well. Thank you very much.